Getting an ALS diagnosis, I mean, it's just a profound, completely life-altering moment. But for U.S. military veterans, there's a really dedicated and, honestly, comprehensive system of support that's designed to meet this challenge head-on. So in this explainer, we're going to break down exactly how the VA provides that incredible care.
You know, when you get news like that, the world can just feel completely overwhelming, right? So many questions start flooding your mind. Finding a clear path forward becomes the most critical thing. So, yeah, where do you even begin?
Well, for veterans, the answer is the VA. And let's be clear, it's not just another healthcare option on a list. It's a system that's been specifically built from the ground up to provide immediate, powerful, and specialized care for everyone who's served.
Okay, so what is it that makes the VA's support so different, so unique? Well, it all starts with this one crucial policy. And this policy exists for a reason. It's based on research that shows pretty clearly that veterans develop ALS at a much higher rate than civilians.
And this right here, this is the key that unlocks everything. It's called the presumptive service connection. Now here's what that means, and trust me, this is a huge deal. You do not have to prove that your military service caused the ALS. The VA just automatically assumes it did. That connection is presumed, and that just removes this massive, massive barrier to getting care right away.
And the impact of that one policy, it's immediate. As a veteran with ALS, you're automatically granted 100% service-connected disability status. And what does that mean for you? It means immediate eligibility for VA healthcare, priority enrollment in the system, and comprehensive medical support, often at no cost to you at all.
So once you're in the system, that priority status isn't just a label. It translates into real, tangible benefits that basically puts you right at the front of the line for care.
You're immediately placed in what's called Priority Group 1. And to be clear, that is the absolute highest tier in the entire VA health system. It's designed to make sure you get the fastest and most complete access to the care you need, period.
So what does being in Priority Group 1 actually get you? Well, it means no co-payments for your ALS treatment. It means full coverage for all related care. You get priority access to specialists and all the services you need. And you get access to specialized equipment and home services. Basically, a huge amount of the financial and logistical weight is just lifted off your shoulders.
Okay, now let's talk about the care itself, because the VA's approach is really considered the gold standard. Think about it. Instead of you having to run around to a dozen different doctors and a dozen different offices, the VA brings all the experts to you, all in one place, all at the same time.
And this is what that team looks like. It's incredible. In just a single visit to one of these multidisciplinary clinics, you can see all of these specialists. Your neurologist is literally in the same space talking to your respiratory therapist, who's coordinating with your physical therapist. It's this amazing integrated model that makes sure every single aspect of your health is being managed together, which is so crucial for improving your quality of life.
And it's not just about the medical team. The VA also provides the actual physical tools you need to maintain your independence and stay comfortable in your own home.
And we are talking about some seriously state-of-the-art technology, all provided at no cost. This isn't just some standard wheelchair off the shelf. We're talking custom power wheelchairs, maybe even with eye tracking controls. We're talking hospital beds, patient lifts, speech-generating devices so you can keep communicating, even systems to control your home environment. These aren't just tools, they're tools for dignity and independence.
Right, because this technology, it's about so much more than just function. It's really about connection. It's about making sure your voice is always heard, both in your medical decisions and just in your life.
And the VA's approach is so incredibly proactive, especially when it comes to respiratory health. See, they don't wait for a crisis to happen. They do regular pulmonary function testing and sleep studies. They introduce support like non-invasive ventilation or BiPAP early on to help improve sleep and energy. The whole focus is on maintaining comfort and preserving your quality of life for as long as possible.
Of course, a diagnosis like ALS, it doesn't just affect the veteran. It affects the entire family. And the VA really gets that. They've built a whole support system that extends directly to caregivers, which is just so important.
You know, this is a really fundamental part of the VA's whole philosophy. Through something called the Program of Comprehensive Assistance for Family Caregivers, the VA officially acknowledges the enormous, and I mean enormous, physical and emotional work that family members put in and day out.
And a really significant piece of this program is a monthly financial stipend. This is money that's paid directly to the family caregiver. It's a tangible way to recognize their incredible work and to help ease some of that financial strain that so often comes along with this journey.
But the support doesn't stop with the finances. It also includes things like health insurance support for the caregiver, specialized training, mental health counseling, and even respite care, which is so crucial. It gives caregivers a vital break to just rest and recharge. It really is a complete, holistic approach to caring for the entire family.
So when you pull it all together, the VA's commitment here is just truly unique. It's all built on that foundation of the automatic service connection, and that unlocks everything else. The no-cost medical care, the integrated multidisciplinary teams, the advanced tech for your home, and of course that incredible financial and health support for family caregivers. It's honestly one of the most comprehensive ALS care systems you'll find anywhere in the world.
And really, this is the ultimate takeaway. The journey with ALS is, without a doubt, incredibly difficult. But for veterans, this entire system was built with one clear purpose in mind: to ensure that no one who served their country has to face this disease alone. It's all about providing the care, the dignity, and the support that they have absolutely earned.